I'm wondering if you could provide details on what percentage of the cases that go through PCR screening test are then put through whole genome sequencing. Is it different based on areas such as Whistler, where you know that there's been a presence of a variant, or what's the most up-to-date information on the percentage that do get through whole genome sequencing?
As I said, about 90% of our every positive test across the province are screened with one of the SNP tests, and if those are positive, they go to whole genome sequencing. And right now, that's a little bit, as you say, a bit of a biased sample, because we are getting more of those positives from places where we know there's circulation of variants. So it is primarily in the Lower Mainland, but all of the ones that are positive right now on the screening test are going through whole genome sequencing. What we are looking at doing is trying to, now that we know that the B117 in particular is fairly prevalent everywhere, we're looking at just screening those ones and saving the whole genome sequencing capacity to be able to do more systematic, unbiased testing of random samples, basically, because we only have a limited capacity per week. So we're looking at doing that with our laboratory partners over the next few weeks.
Do you have a follow-up? As a follow-up, there are some epidemiologists and modeling experts who have said that other provinces released the information on the PCR screening test, and that BC could actually have a falsely low number of variants confirmed, and especially, as you mentioned, there is a little bit of a delay. So is the public getting the full information on the variants of concern, and is there any credence to perhaps releasing the PCR test without breaking down the specific variants, whether it's P1 or the UK, and then following up with the whole genome sequencing numbers?
Yeah, we can do that. We have been doing a combination of that as we've increased the screening that we've been doing. The health authorities get the preliminary positives, and as I said, we've been treating all of them as potentially variant cases, especially since we've seen the increasing proportion. But it really, we've been doing a lot of whole genome sequencing on all of the positives, and the screening is more sensitive, so not all of the screen tests are actual variants of concern. So, but yes, we can look at that. I mean, it's not. It really gives an inflated number of ones that are not necessarily any of the variants that we're worried about, but they are ones that we want to look at. There are many different, the same mutation is in many different variants of the hundreds that we see in the province.
Based on your comments today, it almost seems like you're trying to minimize the variants. You emphasize small numbers. In the past, you've described it as a simple replacement of traditional COVID. But experts keep telling me the trajectory is the same everywhere when variants show up, and that's a rapid takeoff. We're also now hearing from frontline doctors raising the alarm as ICUs fill up, and yet we aren't ramping up with the aggressive testing or doing anything substantive since variants arrived other than closing restaurants. So I'm just trying to understand why you aren't doing more in response to an aggressive form of the virus, because if Ontario's a month ahead, like you mentioned, they've got lockdowns and school closures, why not be more proactive now instead of reactive a month from now?
Yeah, I think you misunderstand what I said. What I said is we're treating all of these as if they are variants. So we have been doing aggressive case management. That is something we have been doing from the beginning. We got overwhelmed at one point in the fall, and we built up those resources again. So every single case is contacted. We are doing contact tracing, both to try and understand the chains of transmission and block them. That's how I know that people are having more contacts now than they were having a few months ago. We are doing extra testing of people, and you've seen that in some of our school exposures where we've tested whole cohorts. For people that we're doing testing of asymptomatic contacts, we're providing support to people to isolate away from their household contacts. So we are doing all of those things as aggressively as we can to try and prevent that rapid takeoff. And we had been finding a relative balance, but unfortunately what what we're seeing is the numbers of contacts that people are having, and those social networks have been expanding in the last little while. So we need to work together on this and to pull it back down.